need to limit businesses. We don't need to be afraid for the health of ourselves and our family. We don't need to hear records in infections, hospitalizations, and deaths. We have now reached 35% of vaccinated people of the total population. Hundreds of medical professionals and thousands of people have made a smart choice. The number of vaccinated people increases every hour. The aim is to reach 70% of adult population by the end of summer, and sooner or later we'll be able to provide vaccination to people in senior high schools when suitable vaccines have been developed, necessary tests have been run, and we are sure that they are safe and effective. Right now, as we open vaccinations to people younger than 50 years, we should all use the chance. COVID-19 has not disappeared. We see countries that are facing major difficulties. We know that in Estonia may see increased infections as we reduced lockdown measures, and the main way to avoid it is to be vaccinated. Hopefully everyone who is invited will use that invitation. You can register yourself at Vaccinated.ee at digital registry. Of course, there is not enough vaccine for everyone who wants that, but through the EU project, we try and have sufficient quantities for everybody wanting it, at least with one injection. And we'll follow that up with a second dose over the summer. In autumn, when infection rates will go up again in the autumn, when different viruses gain ground, we don't need to apply such strict measures. We will be able to keep our life as open as possible. We apply the same principle as we apply in military training. Every step counts. Everyone counts. Inform your friends and family. Let's make sure that everyone in our round of friends has used the chance. So only then can we say that the pandemic is finally over. Thank you.
Thank you very much, Mr. Minister, and the Minister will be ready to answer your questions soon. And next we'll have the functioning of the vaccines, the latest developments. We have here the head of the government's COVID-19 Scientific Council, Professor Irja Lutsar. Good afternoon, everybody. Now, this is the second vaccination information session, and we're still talking about vaccination against COVID-19. Coronavirus is a very serious disease. I'm sure that nobody doubts that anymore. If you look at the slide on the left, then the dark blue columns are men, and men in the age of 80 plus, every second is hospitalized. And the men older than 80, then every fifth is in danger of dying because of it. So when it comes to infectious diseases, it's one of the most serious infectious disease that our generation has seen. So why do we vaccinate against the COVID-19? We are vaccinating foremost in order to protect people against serious disease, so they would not be hospitalized, for a long time or end up in intensive care and under ventilators. And unfortunately, quite often, as it is a serious disease, it might end in death. We want to make sure that our people would live long and would not die too early. So if you look at the COVID vaccines, then it's a really true success story, because such efficient vaccines so fast has never been placed on the market before. But vaccines are quite similar. And in a way that COVID-19 vaccines are not anything special, because all the vaccines have active ingredients, which could be nucleic acids or ready proteins, or it could be inactivated viruses, which would not cause morbidity, but they would cause immunization. Then in addition that we have the inactivated viruses, which are very efficient. So that means that there is also activating agents to strengthen the response. And if we talk about the protein vaccines, they have to be transported to the cell because they no longer have the virus which would transport them. And therefore, they've been coated in the non-replicating viruses such as adenovirus, or in liposomes such as mRNA vaccines. So if we now see what the virus does to a human being, then you can see the blue here is the coronavirus. And in order for the virus to enter the cell, then this virus binds with the angiotensin converting enzyme receptor. So what do the antibodies do? And in order to bind, then the coronavirus has this spike protein. So antibodies block this spike protein, so it cannot bind with the receptor. And as you know, the virus are not capable of independent life, because if they cannot enter a cell, they do not survive. So what does a vaccine do? Vaccine basically does more or less the same thing. So all the vaccines cause the existence of proteins against the which protect us against the spike proteins. It's a recipe for producing it, or there's a gene for spike protein, as AstraZeneca and Sputnik V vaccine, or they enter the purified spike protein, as Novavax does. All the vaccines have been very efficient when it comes to clinical studies. On the right-hand side, you can see the Comirnaty vaccine with efficiency of 95%. And on the left, you can see Vaccinated, which is the AstraZeneca vaccine, with the efficacy rate about 60 to 90%. But I would like to draw your attention, if you look at the right-hand slide, then you can see that here there's a red line and a blue line. Red is vaccinated and blue is the placebo group. So now if you pay attention, you can see the first 2 or 3 weeks, then these two lines move together. There's no difference if you've been vaccinated or not. But then you can see a very strong divergence. And right now we have the data of 6 months as well, which shows us that Comirnaty vaccine efficiency, the clinical efficacy, is sustained within a 6-month period, more or less in the same place where it was during the vaccine studies or after the second dose. So this is very positive information. So often is being asked that yes, well indeed, clinical studies, vaccines work, but how does it work in real life? Do the vaccines function the same way in real life? So here we have the UK data. So the column on the left shows what happens with people if they have not been vaccinated, or there is the usual course of infection. The big green column shows how many people have had symptomatic COVID, and grey column who's had asymptomatic COVID. And there are quite many. And now if you look at the second and third column, so second column is after the first dose and third is after the second dose of vaccine, you can see that these columns are much shorter. So that means that we have almost 90% of elimination when it comes to asymptomatic disease and death. We have very good studies coming from Israel, and Israel was one of the countries which vaccinated very intensely the entire population. So here's the latest research from Israel, and this is on different images. You can see different age groups. And top left, this is age over 65, and green after 1 dose, and dark blue is after 2 doses of vaccination. So, and the red line is the infection rate in Israel. So after one dose, when the 60% of the elderly were vaccinated, then the infection rate started to drop among this older population, so therefore they did not end up being hospitalized anymore. And now if you look at the bottom right, so here we have the youngest, so this is the age group 16 to 24, and here you can see that when the amongst the older people we had less infection than among them, the infection did not drop. But few weeks later, although that very few young people were vaccinated, it was only 20 to 30% who were vaccinated. Also amongst them, the infection rate dropped. So very intense vaccination of the older people. When we have a lot of older people with antibodies, that means it stops the spread of the virus in general. So although the younger people have not been vaccinated so much, but at the same time there is protection from the disease. Right now in Israel, about 60 to 70% of the entire population has been vaccinated. And now we will look at the impact of vaccines to the pandemic. So here we have the UK data again. The top red line shows us what is the infection if there is people have been never vaccinated. So the first dotted line shows where the vaccine entered the market. And you can see that if we don't do anything, then this is not going to go anywhere. So the infection before vaccination was near the red line, and already after the first dose the infection started to drop, so 65% less infection, and it's a huge study from the UK. And after the second dose you can see further drop of the infection. So this is a very good example from another country showing the efficacy of vaccination, and they used Vaccinated and COVID-19 vaccines, both more or less the same. So now if we see what's happened in Israel, then in Israel vaccination started on the 20th of December. This is the red arrow here. But in Israel they had a big spike of infection, as you can see from this image. And they locked down the country as well twice. So when they started with the vaccination, then the infection went up. So there was the first lockdown, then followed by a second lockdown. And once they had achieved a certain level of vaccination, you could see that the infection did not go up anymore. So if 50-60% of the elderly were vaccinated, as it was in early February in Israel, you could see the drop in infections. So followed by reopenings, and Israel is fully reopened. There are very few cases per day. So the strategy which they used allowed them to reopen the country, and it's quite likely that they can open the country to the rest of the world as well. So what has happened in Estonia? Now this is the caring homes and nursing homes in Estonia. So from the end of the last year, yellow background shows the infection rate. I'm sure you all recall that the infection was quite stable until February, and then it spiked. The blue columns show the nursing homes or caring homes patient who had to be hospitalized. Orange columns show the hospitalization level, and black columns show how many of these people died. And red line shows when the vaccination started in nursing and care homes. So if you pay attention, you can see that it would have been logical that when the infection in the population in general went up, then the population of the nursing home should have been infected as well. So we have these we can see that from last year, but it was the other way around. You can see that in a society at large, the infection rate went up, but blue column started to go down. So that means that nursing and care homes showed less infection. That means orange meant that there's less hospitalization from nursing and care homes. And right now, only few patients from nursing home and care homes die due to COVID-19. So therefore, we have also domestic data, which shows us that the vaccines work really well. So last week, we had information from Karjaküla nursing home, which shows that yes, indeed, a lot of people were infected, but none of them were hospitalized, and most of them either they had no symptoms at all or they had very mild symptoms. So this shows us that vaccines function and protect us against this very serious disease as they've been developed. So a lot of people are asking which vaccine is the best. So it's you cannot really answer this question because we've had no studies which would have compared different vaccines, because we have had studies carried out at different times, at the peak of an outbreak or lower point of the outbreak, different countries with different levels of systems. You can't really compare the United States and South Africa. The surveys have been carried out in different populations, some older, some younger, some that have comorbidities and some do not have any comorbidities. And during the surveys, there have been different variants of virus as well. And I know that these variants also impact the efficacy of the vaccine. And the end result is also different because we look at the outcome. Is it the hospitalization? Is it the morbidity? But none of the vaccines have been looking at the mortality. We can see that all vaccines are equally good in order to avoid a serious infection. And for all vaccines, every day or every hour, we have new data available. And we have to adjust our attitudes accordingly. So here we have the UK data again, since they have vaccinated a lot, and so they have been using Pfizer BioNTech or the AstraZeneca Oxford. And here we have on the left we have symptomatic disease rate and in comparison to hospitalization. And you can see that both vaccines are equally good. We do not see one being better than the other because the confidence rate, which is the blurred area, are overlapping. So we cannot say that one vaccine is more has higher efficiency or not. So when it comes to efficacy against serious disease, we have almost 100% when it comes to all the vaccines. Now, vaccines and new strains and new genotypes. So here I have these reasons for concern. UK or the Kent strain, then you have South African and Brazilian strain. So these are of the concern. Then there are other strains of interest which might cause problems perhaps later. So if you look at the UK strain, then we know that all vaccines are good. For Brazil, we do not have much data. For Comirnaty and Vaccinating, they're both good. And pink, which is the South African strain, and if we would have to worry about something, that would be South African strain. And we know that the test tube data has shown that it doesn't bind as well with antibodies, but based on the studies of clinical studies, then they're still on the way. Now, to summarize, I would say that if a person who's been vaccinated, they have been well protected against serious COVID and hospitalization. Vaccinated person might fall ill, but it's very rare that they would pass the disease on to somebody else because the virus load is not very high. They do not have to be in self-isolation. And somebody who's had COVID, then they have to be vaccinated within 6 months. It should be 2-dose vaccination. And before and after the vaccination, there is no need to measure their antibodies. And if a person has been vaccinated, then they still have to observe the precautions. But vaccination is a very important step in order to reopen the society. Thank you for your attention.
Thank you, Professor Lutze. If you have any questions to her, you can do so at worksup.com app. please enter Vaccinating as the keyword for the event. You can also press the button Ask, and your questions in Estonian will be presented there. You can also ask questions on the phone, and the number is 54510950. But next, could I ask the Vice Secretary General of the Ministry of Social Affairs, Mrs. Mari Jesse, to speak about the general situation on vaccinations. Good afternoon. Before we speak about organization, we repeat why, what is the primary goal of vaccination? To protect the most vulnerable groups of population in Estonia for whom the likelihood of serious sickness and hospitalization is the highest. But the other goal is to prevent other illnesses, other cases. They're low to the medical system. There is no need to hospitalize them. There is no need to maintain the constraints that have interfered with the normal functioning of the society for more than a year. Irja Lutsar showed in her presentation data from Estonia how well the vaccines have helped people living in care homes. I would also like to involve figures on hospitalization. In early December, we had nearly the same number of people in hospitals than this morning. We had a few dozen more. In December, the people who needed hospitalization, 8 out of 10, were more than 80 years old. The average age was 71 years. Today, with the support of vaccines, this figure is considerably lower. Both the share of the elderly as well as the average age of hospitalized people. And it started going down from March. A number of elderly people were vaccinated. We use 4 vaccines in Estonia. They've been approved for sale in Estonia, and that's how we've started using them. Weekly numbers of vaccines were limited in December, January, February, and March. We started with the most vulnerable populations, people in care homes, and people older than 80 years. Today, the numbers of vaccines have gone down sufficiently, so we've been able to move on with more and more age groups. Today, we are inviting everyone older than 50 years of age to come and get vaccinated. We have more than 373,000 people that are vaccinated with at least 1 dose. Altogether, 34.8% of adult population has been vaccinated. The minister, in his introductory words, said that our first goal is to reach 70% coverage of the adult population of Estonia. As you can see, we are halfway there at 35%. By tonight, it'll be more than 35%. All in all, more than 500,000 vaccinations have been carried out, and the lower graph shows the capacity of vaccinations. So we will not be held back by the shortage of vaccines. There will be enough to use them as needed. How has vaccination gone all over Estonia? In majority of counties, 4 out of 10 adults have been vaccinated. The most at Hiiumaa, half the population has been vaccinated. Unfortunately, there is certain lag in Harjumaa and Ida-Virumaa, unfortunately also at Valgamaa. The map that you see is available on the healthcare board, and you can also check it at the parish level to check the age groups in Tallinn, and you can also check the municipalities by age. Where is vaccination higher, where people are better protected, and where there are shortcomings. I must say that the Harju County that the lower coverage in Harju County is Tallinn, big municipalities in Tallinn. At the same time, in 11 counties of Harjumaa, vaccination is at a very high rate. Our first goal was to protect as best as we can, that is at more than 70% coverage, people older than 70 years of age. We achieved that by the end of April in most counties. This goal has been achieved by doctors, other vaccinators. Unfortunately, 4 counties lag behind. Võru will reach the 70% very soon. The best coverage is in the age group 70 to 79. You see in half the counties, vaccination coverage is near 80%. It has either gone above 80% or will reach that very soon. That gives us confidence that Estonians trust the vaccine. They are afraid of the sickness, and that is the right thing to do. You need to be more afraid of the illness than the vaccine. We all have the chance to live our life as close to normal in the autumn will depend on how well we protect ourselves and our beloved elderly as best as we can. As you can see, this is real, not fanciful thinking. What next? Now, everyone older than 50 years of age are invited to be vaccinated. At the end of May, opportunities will open up for everyone. Not everyone at the same time, since we receive vaccines on a weekly basis, but we will have a chance to give vaccines to everyone coming in. It's possible we'll introduce another age group. Our working group is discussing it now as we are at the information break. And they are organizing how exactly discussing how exactly will we organize vaccinations. There will be a higher number of temporary vaccination centers and vaccination offices at hospitals. At the webpage Vaccinated.ee, you'll see the vaccination hotspots, their opening hours, opportunities of getting vaccinated, the dots and numbers on vaccination centers and offices will be added on as they become available. Opening hours will depend on the number of vaccines coming to Estonia and also how fast people will make use of the slots that have opened up. That's it from me. And go, just as the internet page says, vaccinate yourself. Thank you.
Now we have listened to the presentations, and I hope you'll have some good questions when what you had in mind due to vaccination, or you have new questions after you've listened to the presentations. You can send your questions to worksup.com. You enter the keyword, which is vaccinate, Vaccinating, and you can enter this platform. And then there is a question button which says Küsi, and you can send your question in Estonian. And you can use this additional opportunity to submit your question by a phone, which is 54510950, which is 54510950. And now we try to answer as many of your questions as possible. But now let us meet the experts. So now the experts are all present, and we have the visors to protect us, although I think most of us have been already vaccinated, but of course safety first. So we are quite many of us in the studio today. But let us start with the questions and let's try to find suitable answers. So on the 17th of May, we start vaccinating all the interested parties, but how are we going to register people who want to be vaccinated? Mr. Minister. Yes, indeed, because we had the vaccination working group meeting discussing the technical details, how the second half of May we can start with the vaccination of a population, because we don't get hundreds of thousands of vaccines at one go, but we get them batch by batch. So tomorrow we'll have another press conference. And with the vaccination czar, we will discuss it, but the registration will be through the digital registration and by telephone in hospitals. And also the family physicians will continue the vaccination of the elderly and this risk group. Second question, as we know that after the vaccination, you can still spread the virus. So how is this vaccination, this virus being spread by a vaccinated person better than virus being spread by non-vaccinated people? Yes, indeed, we have a lot of data right now, and we can see that people who have been vaccinated, then they have a lower virus load. They just have less virus present. I agree that virus is the same. The virus hasn't changed, but there's just less of it. But now, people who have been vaccinated, how much they can spread the virus, it is not quite known yet. It's possible that they get infected, but they have so little virus that they cannot pass it forward. So this research is ongoing, and since the opinion is that because the virus load is small, so therefore they do not infect anybody else. So therefore vaccination is better than non-vaccination. Next question. To which extent we have the South African strain, and when do you have to vaccinate after you have had AstraZeneca vaccine? You can clarify. Right now we do not have much of the South African strain because I haven't seen the data of this week yet, but every week it's been less than 3%. We have new cases with South African virus strain. And the question is right that AstraZeneca is a bit of an issue when it comes to the South African strain, but we have to wait for data that what we do see in real life, because we do not know yet when do we have to have the additional dose of vaccine. We have to wait for data. Pfizer came out with their new data showing that with Comirnaty 6 months and clinical efficacy still remain, but we're waiting for AstraZeneca. And the health board would like to specify. I wanted to add that we have had few cases every week, and most of these cases have been people who are connected to each other. So we cannot really talk about the spread or widespread of South African strain because we've been able to find them quite well. Another recommendation to the population, because right now is a time where it makes sense to spend your holidays at home or not far from home, because of course I love traveling to exotic countries as well, but taking into account that this virus is being imported from traveling, and there's some other strains as well. So stay at home, stay in the nature, or travel within the European Union countries where we know what the virus situation is, we know what the strains are, and if there is a problem, then you get a hospital treatment, which is not guaranteed in all the countries. Next question. So you've had a first dose of AstraZeneca and you have some serious effects. What happens with the second dose? So important side effect which would not allow for the second dose is allergic, or the very rare thrombosis which might happen with AstraZeneca, or some sort of other blood circulation related issue, because then you should either remain with one dose or discuss it with your GP. This is a question I've had every day, and my patients ask the same, because the side effects has been tolerable, as the health board said, that there are no contraindications. Then we encourage to finish the vaccination, and these are most of the cases. You have to finish the vaccination with the same vaccine, because right now the research is ongoing, and in May we should have data available from combination of vaccines, that you start with AstraZeneca and you conclude the treatment with an mRNA vaccine. I would wait for the result, because AstraZeneca is good because we can extend the time duration between the two doses. Nothing happens. So if this data is available in May, we can see what happens next. Moving on. I'm in my 20s and I have a comorbidity and I'm in the risk group. In early March, I got AstraZeneca vaccine, but now my GP has said it's not advisable to get a second dose of vaccine with the same vaccine. So how can I get fully vaccinated in this situation? I think this is the case where we have to wait for the data from May and see what happens, because with AstraZeneca, it's better to wait for longer. GPs are keeping an eye on the vaccination committee decisions, and patients under the age of 50 are not recommended to have the second dose yet. So what happens with people who have not had antibodies after vaccination? Are they vaccinated with some other vaccine, or they are considered to be non-vaccinated? We have about 5% of these people, based on the UK study. 5% of the people do not have any antibodies, but it does not mean that there is no immune response. Maybe it's not a cell-level immunity which you cannot measure yet, because this is not the only vaccine where you don't have antibodies post-vaccination. Because right now, these people post-vaccination is no point to measure antibodies, because there's nothing we can do with it. And we are not going to vaccinate these people with any new vaccines either. We're just waiting for new data, because we don't really know what the titer of antibodies should be in order to be protective of infection. Next question. When we're planning to use this approach, that in the areas which have less people who are vaccinated, they get more vaccines, because in Harju County it's quite low, but it's easy to find the vaccination appointments below 50, but then in other counties it's not quite the same when it comes to availability. because right now we're using this approach and we are sending more vaccines to the counties which are lagging behind in order to improve the vaccination of the elderly and the general population. And GPs can request more vaccines if the elderly have been vaccinated. With the we have different levels in different counties. There are some rural municipalities or district where the inclusion is average, but if they have been vaccinated less, then we have to pay more attention to them. We have been contributing, of course. We get weekly vaccine batches, and in every age group, so we have several 100,000 people who have not been vaccinated. But as I said, we will have vaccines for everybody. We have ordered with oversupply, so everybody will be vaccinated. And Viljandi Hospital orders 200 and they're being booked, but in different places. We know that there are some available vaccine appointments. Do we have to risk public transportation, travel to another city to get vaccinated, or should we then change the system based on the vaccination activities? It makes sense that you should be vaccinated close to your home, and if Viljandi Hospital vaccine appointments are all gone, then we have to take that into account when we are requesting vaccine doses for the following weeks. For this specific week and maybe the following week, it doesn't quite happen yet because these vaccine timetables have been prepared for a longer period. But at the same time, nobody wants vaccine doses to just sit there.
And we'll continue. Since June onwards, AstraZeneca will no longer be bought in. What will happen to those who have registered for their second dose in June? I'll take that. We have acquired 5 times the initial plan of AstraZeneca. 1.5 times the amount of AstraZeneca. This means we have an actual cover for the second dose, either existing in the country or it will arrive this week, so no one should be worried. We have about 65,000 people waiting for it, and we have the number of available vaccines. We will have about 20,000 vaccines coming in this week, and there will be more coming in by the end of the month. So there will be enough vaccines for the 50-plus age group. If you joined us right now, go to worksup.com, find the event Vaccinating, and you can also ask questions at 54 51 0950. But there are more and more questions here. If you were vaccinated before falling pregnant, vaccinated with AstraZeneca, what are the recommendations for the second dose? Irja? Pregnancy is not counterindicated. If a person wants to get vaccinated, you can also get your AstraZeneca vaccine. Thank you. Next question. We've known cases where the coronavirus test has been false positive, and these people will be vaccinated with 1 dose. Shouldn't we determine the number of antibodies? There may be very few of those cases, but usually people that have had doubts whether the test is positive or negative, the test is always repeated. If the laboratory will have doubts, it will be repeated. So these people will not be listed as those who have recovered from corona. In those cases, it's justified when somebody feels, I was ill with coronavirus, my PCR is negative, so based on the talk alone, you should have an antibody test. The next question is quite lengthy, but let's see if we can manage it. Now, the question is about people with people with transplants and vaccines. I'll read the question. John Hopkins University is carrying out its study in parallel with vaccinations, and according to that, there will be limited antibodies for those that have had transplants and 2 doses. Vaccinations can give a false sense of security because antibodies will not be created. Could it be possible for having people with transplants be given a free antibody test because if they don't have a chance of having a third so-called booster dose? Would that be possible? Definitely. This is a very complicated area, and it's quite clear that the first studies on vaccines will not include people with such illnesses of the immune system. Maybe we should use higher doses. Maybe we should have more frequent vaccinations. We simply need to learn data from bigger centers that have more patients like these. I simply know that the studies are underway, and in every single case we need to look at that case by case. Determining antibodies is not a problem, and healthcare fund will pay for it. Usually we have antibodies as a test that will be paid by the patient themselves. When will the database be compiled by under 50-year-olds? Why don't they think about the bottleneck? Well, we've thought about all these things, but the bottleneck is not IT, it's vaccines. If you have 20 or 30,000 for the first dose, so you can't really divide them for 500,000 people under 50 years of age. It does take time. I'm saying that everyone under 50, older than 50 will be covered in May or early June. Those who want to take some more time to figure things out for themselves, it'll be possible for them later on. The bottleneck is shortage of vaccines. If we'd had the vaccines, we'd open pre-registration, we'd arrange it on a wider basis. We simply need now to understand that vaccines will be a deficit all over the world. Marle says that a positive antibody test is not a proof that I've been recovered from corona. Then I should be getting 2 shots or 1. 2,000 is quite a significant concentration. Marianne will comment on the first part, I'll comment on the second. I think that here 2 doses do not need to be administered right away. Maybe in a year the next dose is required. But Marianne will be able to comment that. We've discussed, and the debates have been going on for weeks, whether an antibody test would be considered as proof of recovering from COVID. Experts and the health board are on the opinion that it can be. But the questions arise, and an antibodies test, when is it still valid? When CDC says that 3 months from antibody test, you need to antigen test. You don't need to self-isolate. Where do the agreements get stuck? There is no one reference level. At what level antibodies should be considered as having been ill with COVID? I'd say that 2,000 is a clear sign of having been ill with if the test is done properly. Rather, there are questions here as to who has 49, 48, 50. Is it properly proper illness of COVID? So we have these debates, we have these studies, and we are not far from having an agreement here that a positive test is a proof of having been ill with COVID, and based on that, vaccines will be administered. Family physicians, GPs, have been given a notice that they will not administer first doses anymore. This will be done in a vaccination center. Oh, that is a misunderstanding. There was 1 week where we didn't have enough vaccines. All medical GP centers are going on vaccinating people. Let me specify, GPs are working very hard. 63% of all vaccinations have been done by them. We wanted to have big centers. Actually, we see GPs reaching the elderly, risk group people, and their coverage very good. In parallel, where GPs do second dose of vaccinations and vaccinating younger people, so it's just reasonable to give more vaccines to vaccination centers that will be vaccinating people under 50 years of age that are more mobile, for whom it's easier to get there. So it's easier to store AstraZeneca. So as I said, the volumes will go up. mRNA, Pfizer, Moderna, and others will be spreading the vaccines through vaccination centers and GP offices. So the vaccinations will go on for months and months. There will not be constraints on that. Next question. Can you choose your vaccine? In a sense, you can. Digiregistratur. Vaccination centers and hospitals open up slots according to the vaccine, so people can make their choices. Over the weekend, we found that user experience wasn't good enough, so that will be amended. But first and foremost, a doctor will give a recommendation on the vaccine. That is most important. And next question. Having 1 dose of AstraZeneca, has it been strictly banned to be given the second dose with Pfizer or Moderna? And will that decision be reviewed as a result of new studies regarding AstraZeneca? Let me start from the end. As new studies come in, we are reviewing things all the time. Right now, we simply don't have the data. The discussion is very aware that we have studies underway. Immunization expert committee gives recommendation on those that we have data on. Right now, we don't have data on combining the vaccines. As soon as we do, we'll amend our recommendations. So it's very hard for someone to choose sometimes as what it is that I want. You must be aware on the grounds on which you make your choice. Let me add here that there is another aspect here. How many other vaccines are there in Estonia? Right now, it would mean that mRNA second dose means that someone below 50 won't miss the initial dose on the messenger RNA dose. We will not start new vaccination plans on AstraZeneca for people below 50, but those that have been started will be continued or completed there as well. That is the medical advice from European Commission as well. I'm a German citizen. How can I get a vaccine in Estonia even if I paid for it? If he's listed with a GP, we have Americans, Israelis, others, then this vaccine is free. If they don't have a family physician or a GP, then it's complicated. It's quite unlikely that a German tourist will be following this information hour that is happening to be here for a few days. But if they live here, all people living in Estonia should be as well protected as possible. If they don't have a GP, they can go to the vaccination center or to a hospital that does vaccinations. Throughout the crisis, testing, vaccination and counseling is available for everyone living in Estonia, in spite of their citizenship, whether they are insured or not. Tourists, yes, we don't give them free vaccines here because there is a deficit of vaccines. Testing is possible, they pay for it, but for people living in Estonia, both testing and vaccines are free for them. Is there a scientific study based on which you can say that after complete vaccination, but if you become infected, you will not spread the virus?
There's nothing guaranteed, but as I said before, that we have information. We have not had many trials yet because first people were vaccinated only in December. So in clinical trials, there were not so many people involved. So right now, we do know that people who have been vaccinated or who have had the disease, they have a smaller virus load. So therefore, we can assume that they do not spread the virus so much, which we can see with people who have had the disease and who have been vaccinated. Yes, very seldom ill. Yes, they can both get infected even if they are vaccinated or they've had the disease before. But as I said in my presentation, the virus burden is lower and they do not really get sick. So if you joined us right now, then you're looking at, or you're watching us the vaccination information session, and you can send your questions to the expert. You have to go to theworkshop.com. You have to enter Vaccinating, and under questions and answers, you can submit your question and in Estonian, and we are going to try to answer them because we have a lot of questions. And in addition, you can use a telephone number which is 54510950. But let us continue. The next question. So what is the reason why the plan is to no longer vaccinate by age groups, especially as we know that there are not enough vaccines to all the people who want to have it? Because we have a lot more people who are over 40 than over 30 or over 20. So it's both ways, because some say that why you have a separation by age groups if we know that the hospitalization risk is lower below 50, and the others said why continue. So in the working group, we are looking at the vaccine deliveries, our digital capabilities. It's not only registration, but the hospital information systems as well. And we can say if we talk about younger people under 50 who have some comorbidities, because they've had the possibility to get vaccinated for months already, because we're still inviting all the risk groups, regardless of age, to be vaccinated. So even if you're 30s or 40s, and if you have been hospitalized, then this is not normal, because there is a reason, there is a comorbidity. Therefore, they're in a risk group and therefore they will be vaccinated. Anything to add? So Pfizer information sheet says after 21 days after the first dose, the vaccinated person has to be vaccinated second time. Why do we have to wait for 2 to 3 months? Doesn't mean that we have lost the protection of the first dose. We don't have to wait for 2 to 3 months, because in Estonia we recommended 6 weeks gap. And many countries have done that. It's not only Estonia, because our neighbors, Finland's done that. The UK has recommended 12 weeks. The UK has used this opportunity since December, and if you look at the infection rate in the UK, then the strategy has been good, because the UK is reopening because the infection rate is very low. And the reason being that the first dose gives a very good efficacy. It's 85% for the first dose. So the idea was that to protect at least 85% most of the people, so we can get rid of the virus in the society faster. And very few vaccines, the second dose comes with the short term, because usually you have the second dose a lot later. But now I understand the people wanted to get the 2 doses done very quickly. And so this was a conscious decision in the vaccination committee. It has been discussed. And to add, The initial Pfizer Comirnaty information sheet said that second dose 21 to 42 days. And then countries started to use different intervals, which created a bit of confusion. And that was the first vaccine which was developed. And then the information sheet was then expanded. So everybody got 21 days interval. That was the first month in Estonia as well. But then the vaccination committee made a decision. So in order to move on faster with the with the first doses, because February the infection rate had gone up and the hospitalization went up sharply every week. So therefore it was important to protect the vulnerable people as quickly as possible. But we did not decide to use the same interval as the Finns and the UK, which is 12 weeks, but we stayed with the maximum interval, which is 42 days when it comes to Comirnaty. Thank you very much for these answers. Next question. What information and feedback do you have on BioBlock nasal spray? We have not had feedback yet. It's not treatment. Yes, they are antibodies from the bovine milk, and it has to be worked. But we do not know if it works for humans. It's a protective measure people can use, and it's safe to use. But it's not a treatment. It's not medication. Yes, indeed. When it comes to the health board, then we do not have the information on how it functions, what the experience has been. And since we do not have much of research data which would show that it works on people, then right now we cannot really count on this nasal spray, that we do not use a mask. Or when somebody has been in close contact with the infected person, then we're using the spray, we still have to observe all the other measures which have been recommended based on all the rules and regulations established. It'll be interesting to read the research publication articles, because what happens in the test tube, what happens in within the person, but I haven't found any information yet. I suppose we've found from this discussion that I do hope that the producer and the researchers will go to the end of it, because it's accessible on the market. It's not registered as medication, but the trial will be carried out, and we can then assess the efficacy when it comes to the reduction or prevention of the disease, and therefore will be easier to make the decisions whether we should recommend it or not. But it's positive that this kind of development happens, that there are some additional measures which would be possible to use, but we cannot recommend anything unless we know that it actually helps. So your vaccination is complete. You've had 2 doses, and when you have been in close contact, you do not have to remain in a self-isolation after a certain time period. For AstraZeneca, it's 84 days between 2 doses, and then plus 15 days after the second days. So it's total of 99 compared to Pfizer. So some people have really serious advantage. So how to reduce this kind of inequality? As I said, some countries have decided it to do so that with all the vaccine doses, you wait for 12 weeks. Would it be AstraZeneca or would it be Moderna? Now Johnson & Johnson, of course, it's only 1 dose. So inequality is included in the process in a way. So I think we just have to accept that. Maybe the minister can answer. So there was a bit of an error in the discussion, because right now Pfizer is 6 weeks, so plus another week. So there's not such a big difference. So you can say one gets Janssen, then it's 2 weeks and done. There's greater inequality because 1 shot is enough. So I would say that it's a half empty, half full, because I would say that most people in the world have not been vaccinated. So it's not that 99-day count or anything else, because whatever vaccine you're being offered, then I'm waiting for my second dose in mid-June. I've been in close contact because I haven't got the second dose yet, so I had to avoid contacts. But 1 dose is better than 0, and waiting for the second dose is a luxury, considering that most people are waiting for their first dose vaccine. Thank you. Health information is confidential, and the employer should not request information about on health data. So why would the employee need to give the employer information about their health data or vaccination status? Here we need lawyers. I'm sure that they can answer this much better. But there are some situations where the employer needs to know if the person has been vaccinated or not in order to arrange the work, because this has happened in healthcare facilities and nursing homes. In some other jobs, perhaps it is not equally important, since the people who need looking after are not as vulnerable as they are in healthcare and nursing homes. But we need to have the legal base from the lawyers, and we do not have any lawyers here. So we'll continue. Tartu A. Le Coq Sports Center, young people get vaccinated as they queue, but the people who are in vulnerable and risk groups, they have to wait through the digital registration. So first of all, I would not know that it is actually so, because right now we vaccinate 50 plus and risk groups, and in exceptional cases younger people have been vaccinated as well. But if you look at the age groups, they are exceptions. If you look at this progress, I would say that it's the question for the vaccination center. So if they had problems like this, we should maybe check that. When it comes to the Tartu Center, then all the vaccination times should be visible through digital registration. So therefore, somebody who's in a risk group should be able to book their time through digital registration. So all vaccines should be covered with appointments, and they should be visible in digital registration. Thank you. When it comes to medium-sized companies, how they can request vaccination in-house if they are client service providers who are coming into contact with many people. Because it depends on the field of activity and how many people, because medium size, over 50 employees then. So because micro, small and medium, it really depends on the field, and maybe it'll be a good idea to contact with the Marek Zell, the vaccination czar, and his team to get more information. Because with the government office, we have the working group who is coordinating it. And we are working most with Northeast Estonia with the highest infection and least vaccination. So we try to organize vaccination there, and the rest is based on lists submitted by the ministries. When it comes to people who've been vaccinated, do they have some possibilities to do other things? So the theatre, sports club for vaccinated people? Yes, indeed, this kind of discussion is ongoing right now. And when it comes to the pandemic, then this situation is a little bit different compared to the regular situation. So therefore, these kind of special solutions are under consideration. But in Estonia, before any of these measures will be applied, the vaccination should be available to all the people who want to get vaccinated. So therefore, if somebody does not want to be vaccinated, that means that they will give up certain freedoms or benefits. And another aspect to that, there has to be very clear how we're going to continue with children and people who cannot be vaccinated for some reason, because you cannot really discriminate.
There have been many debates on that at the Ministry of Social Affairs, at the Health Board and whatnot. Before we get to these exceptions in practice, it's important to give everyone a chance to be vaccinated, and also you can't really ban access to state services. Certain differences, like the US has applied, is unvaccinated people need to wear a mask outside In Estonia, no one needs to wear a mask outdoors. So there are certain options and choices. These need to be discussed at length, and tomorrow we plan to discuss it in the government. At the government, we don't need to make any decisions. There are legal, ethical, medical questions before these decisions can be made. How long do I need to be self-isolated when I'm fully vaccinated, but I still got a positive result? According to the order given, you don't need to be self-isolating when you are vaccinated. But since new data is coming in, especially on the strain, South African strain, we look at it case by case, we assess their safety. So we solve these issues based on the situation. We look into details, we'll find additional we look for consultation with doctors and other experts. It also depends whether are they only PCR positive or do they have symptoms as well? As I said, people can be infected again, and then the same rules apply for non-vaccinated people. Certain time needs to pass, symptoms need to alleviate, and so on. Whether a breastfeeding mother can be vaccinated. They can vaccinate, it's not counterindicated, but we have very little data. You should always consider whether I'm working or there is a threat of getting that infection. Then vaccination is more important if I'm really at home with a baby and I rarely go out. In that case, the vaccination can be postponed. This is a practical question from everyday life. All 4 vaccines available in Estonia. None of them will leak to breast milk or be transferred to the baby. Does the health board plan repeated vaccinations after a year or after any other period to extend the corona passport? Is repeated vaccination free for people? We are not planning for repeat vaccinations to extend the corona certificate or corona passport. But the additional vaccinations will probably be there at some point. We are now there are studies being carried out as to when will it need to be done, whether it's free or people will have to pay for it. Or some people might be able to answer that. Repeated vaccination is something that we are preparing for. EU has already concluded agreements with Pfizer. BioNTech 1.8 billion dose can be bought by the countries. Estonia will decide joining that agreement in the nearest future. But right now, our attitude is positive. We don't know how long the current situation will last. It would make sense to guarantee supplies for us. As regards vaccination certificates, currently the state immunoprophylactic is considered to be considering the immunization to be indefinite. But Maris Jesse, as a head of that committee, will speak about it at length. As Vauci said, he said that it's neither Pfizer or Moderna that will decide that. Countries will decide when they'll do repeat vaccinations. Heads of both pharmaceutical companies have said that in 6 months a new vaccination needs to be carried out, but scientific circles have been quite skeptical about that. Right now we have the data that we have 6-month clinical immunity, so we'll simply need to wait and see. By autumn, we have more information, and that's when we'll give more specific guidelines. It'll also depend on the new strains And it's possible that the revaccination will be based on who got what vaccine the first time, how well that protects against possible new strains, and we'll take it from there. Pharmaceuticals now have a plan B. They are already testing against the new strains. We'll have a brief pause here and have a sip of water. We have about 40 minutes left to answer questions. Go to workshop.com, enter the event ID Vaccinating, and you can ask questions there, or you can ask by calling in on 54510950, and we'll listen to what Arkady Popov has to say. As a doctor, I've seen in a year what corona can do to somebody's health. For the young, for the old, for the sick, for the healthy. That has turned me 100% against the corona. Most of doctors have been vaccinated, me too. If it's your turn, don't doubt, protect yourself against the virus. Vaccinate yourself as soon as you can. Look at vaccinated.ee. Welcome back, and we'll continue with Q&A. In Tallinn, it's impossible to find a slot at ITK and BER. You need to check the news to find out when possible slots open up. How does that situation support the current communication? A very difficult question, and I'll take it. As I said before, the main concern is a general deficit of vaccines. Times will be displayed if slots will be displayed if previous times have been fulfilled, or we know that the vaccines have arrived. So if the deliveries do not come in at the right time, then we'll need to cancel all the slots. So there are hundreds and hundreds of people waiting for the slots, whether it's a weekly interval or longer, and we know that people will be able to protect themselves in May or June, later on with the second one, and the goal is to cover 70% of the population by autumn. We're halfway there. Okay, and we'll continue. Should I avoid other vaccines before or after corona vaccine, for example, against the ticks or anything else? We don't know. Since there were no tests run with other vaccines, you cannot give recommendations for and against. But the data we have, then if there is a week or two interval, there is no problem with other vaccines. We haven't studied co-vaccinating, but it's usually good to have some interval there because different vaccines have different impacts, so it just makes sense. 14 days is the general recommendation to have between different vaccines. Although they say that teachers are frontline workers, why aren't university teachers vaccinated as frontline employees? We are saying that we'll vaccinate frontline employees from February. It's not like for the elderly, but we started vaccinating frontline employees with AstraZeneca. From teachers, we started with those whose students will have the hardest time with distance learning. And then we moved on to kindergartens and universities. Usually we'll start with those that have practical classes. Of course, we would have liked to offer that opportunity for everyone, but then we had an opposite recommendation for AstraZeneca, initially for not after 60 years of age, then it was above 50, more than 50 years of age. So we'll try and be dynamic. And I think that's a fair approach, since it would be worse if the state would stick to their earlier recommendation irrespective of recommendations given in between. It is really unfortunate that frontline employees couldn't be vaccinated and continue with vaccinations from mid-March. Many universities had started distance learning, but we also had people listed, we had people in food stores, supermarkets, as frontline employees. They definitely have a higher risk than distance teaching at universities. But now everyone will have a chance for vaccination and they'll use it, hopefully. Irja Lutsar claimed that someone vaccinated will be ill with limited symptoms. Can it lead to asymptomatic infectors in younger age groups who will not wear masks, as those who have the yellow passports do not, and they also shouldn't have PCR tests? Shouldn't we give up exceptions for those that are vaccinated? That is a philosophical question. We don't know very well, but we are getting information that vaccines curb the spread of asymptomatic illness as well. That was not the initial goal of vaccinations. In early studies, that wasn't even tested because it was important to get rid of serious illnesses. What is the role of asymptomatic people in transferring their illness? It's not quite clear. For SARS-1, they didn't spread at all. For SARS-2, they have less virus. They'll probably spread less of it. So we don't have 100% surety here. This is about finding a balance. Estonia made a decision for people that are fully vaccinated that they don't need to be self-isolated. But we still don't know whether vaccinated people should have additional rights or possibilities domestically. So if the restaurants have 25 to 30% occupancy, can you have more people there if they are vaccinated? That's the basis of all these decisions. What are the risks that we are going today? How much do we want to restore life as we know it? And we do that in a safe way. The question referred as if mask wearing is taken down. No, everybody needs to wear a mask, those that have been vaccinated and those that are not. In the final meters of the pandemic, we can decide what are the additional options, but no additional decisions on arrivals from other countries or contacts has been made. Thank you. Is it correct that for Johnson & Johnson it's sufficient to have just one injection, and do all other countries accept it if only one injection is entered, because for others then usually 2 shots are required? Johnson & Johnson is carrying out 2-shot studies. They have licensed to the market with 1 shot, and that is correct information. Thank you. Is it recommended to be vaccinating pregnant people? An excellent question and a very practical one. Since pregnant women suffer harder and results can be quite serious. Not only miscarriages, but the death of the pregnant one. This is supported by studies as well. I think it is published by now, yes. They carry the vaccine well, and the studies carried out included pregnant people. Then we need to weigh the benefits and threats. And the benefits are definitely higher, especially for people that have aggravating circumstances, or you work in a hospital. If you just stay in your farm, away from other people, of course it's different. But they are still carrying studies on antibodies in the pregnant people. A question on antibodies. What are the limits? Data is confusing in comparison with the rest of the world. Different countries use different units. US uses above 0.8. Very good is 150. In Estonia, it's 3,000, 8,000, 12,000. What is the unit for antibodies for someone to be assured that they have protection?
Each lab is using different tests and they validate their own tests. So this is on arbitrary units, how it's expressed, that some of the American labs are using some other tests as well. So as Mariana said before, that we do not know exactly, because there is a certain value, but we know that below which we can say that there are no antibodies. So I know what is the figure above which we have the antibodies. So you cannot really compare them, that somebody else had this much in America and in Estonia we have this much, and so antibodies are not there for comparison. If a man has so many and a woman has so many, it doesn't mean one is better and one is worse. Anything to add? Yes, indeed, there is no agreed value, and as Irja said, it's very individual, because some have, once they've had the disease, they have less antibodies, some have more, but both are immune. Because we have a cellular immunity as well, which has an important role, and it's very hard to say what is one accepted value. But once you have the positive antibody test, then either person has had the disease or they've been vaccinated. Let us continue. Traveling in July in Europe, how is it going to happen if you are not being vaccinated? It really depends on where you're going to travel, because first of all, I would like to check what are the requirements of the country where we're going to. Because there are all sorts of requirements and different countries have different requirements. So first of all, I would find out what is this country demanding inside Europe, outside Europe. So what they would like to see. So we have to start with that, because it does not depend on us. Australia's been locked down, New Zealand is locked down. It does not depend on us. And there's another aspect as well, because this question was about Europe. If we are traveling to other European country member states where it's warm already now, taking into account the capability of the local healthcare system. So if there is a pandemic on and other diseases as well. So there was a very sad case where in Egypt, a family was on a holiday and one child died because the local healthcare was not accessible enough. So not all countries, the healthcare systems can survive this pressure they are under right now. So you really have to be careful about where you're traveling. And I usually tell the patients to look at the Travel Smart website, because their requirements are there. Because you say we don't know what's going to happen in July. There's been no arrangement yet on the rules. Some countries say that people who have been vaccinated have more freedoms. Maybe some change will be in May and June. If there is less virus, maybe there is less of the isolation requirement. Depends on the source country infection. But last summer, We kept an eye on which country the person is coming from. Do they have a self-isolation requirement or not? So if we before we travel, we should look at the obligations. Would it be their obligation to stay at the hotel and something which might mess up your holiday? And this information changes all the time, because today it's impossible to say what might happen in July. I got the post injections of AstraZeneca, and there was also some discussions about the side effects popping up months later. Well, you're lucky because you got 2 doses of AstraZeneca. It's a very good vaccine. There is no cause to worry, because a lot later after the vaccination you will not have any side effects, and the only worry you have with AstraZeneca is the reduction of platelets, which might cause the deep thrombosis. And so if you have received AstraZeneca, you should check for hematomas. So if you have any hematomas or any bleedings which are unusual, not just one-off nosebleed which might happen, or there is some indicators for thrombosis, you should talk to the doctor right away, because it is easily treatable if treatment comes in time. Let us continue. What has the government done so that most people over 80 have been vaccinated? There was information about only 0 to 9% of the population over 80 having been vaccinated. So who is going to be responsible if these people fall ill? Well, we have the member of the government here. So I'll start with the technical answer. So people over 80, then they were part of the first risk group, and they were in the vaccination plan, and vaccination was started already in January by the family doctors, and many GPs have done a lot of work, because right now we are taking vaccination as self-evident. By the end of January we had only one vaccine. We had some marketing as authorization a month prior, so it was new. And in December, we had about half the people who were certain they were going to be vaccinated, but right now it's 80%, if I recall correctly, especially among the elderly. So it was started slowly. GPs, family nurses have done a lot of work. So January, February, March, so they have talked to people why this is necessary, so the people would not be hesitant about the novelty of the vaccine. And now a month ago we had more detailed information about the extent of vaccination, and the health insurance fund has been in touch with these GPs, and all the people who want to be vaccinated can get vaccinated, so they will not be left without protection and without help. Everybody had certain circumstances why they could not progress as fast. So the problems might be due to the patients or due to the doctor. So it depends on this the size of the risk group, because one thing is figures. But if you don't have many patients and they are all unvaccinated, then its percentage is high. But if you have a lot of risk group patients, then your figures will look better. Because, of course, it's the health minister who is responsible for vaccination, as Maris has said, that we have mapped these GP centers. We have 785 lists. 400 centers. So usually it's quite people have been quite well vaccinated, and there's some problems. Sometimes the doctors have been sick, sometimes it's been problems with orders, sometimes people have needed encouragement. and other GPs have helped each other, because if there are replacement issues, or then others will help to vaccinate it. And through media as well, we have discussed to the young people and the elderly that talk to your GP, that if you are over 70 and you have not been vaccinated, or your mother, father, or somebody has not been vaccinated, talk to the GP, because the vaccines can be ordered for this age group. So we're keeping an eye on this until everything is done. So the older people who want to get vaccinated will get vaccinated. Of course, it will continue for months. And most people say that it's easier to get this 50% who wants to get vaccinated. Now we have these people are vaccinated, but now you have to work more and more with every next group who are hesitant, who has had some temporary difficulties, but it doesn't mean that we're not continuing, because we still have to reach to this 70%, and we are carrying out this monitoring on a weekly basis until we see the results. Thank you very much. We have a little bit more than 15 minutes to answer the questions. So if you go to workshop.com, and the keyword is Vaccinating, and you can submit your question in Estonian, and I hope we'll have possibility to answer. You can also use the phone 50. And the phone number is 54 51 09 50. But due to certain disease, I can only use the Moderna vaccine, which is not accessible in Harju County. Why are all the Moderna vaccines sent to Northeast Estonia? I can't even imagine what kind of indicator it would be that there's only one mRNA vaccine which would be suitable, because they're actually quite so similar of the function and of the side effects. So I would understand that mRNA would perhaps be better than AstraZeneca, especially if you look at certain age groups, but we should really verify what is actually happening here. Why only Moderna would be suitable and Pfizer wouldn't be suitable. But not all Moderna goes to Northeast Estonia, but with Moderna vaccination started in Hiiu and Saare Islands and West Country, because vaccine logistics and Moderna was easier to organize, and the storage in a regular fridge was easier to take it to the islands. But there is more Moderna available. It goes to Northeast Estonia, and Medicum used also a Moderna vaccine for vaccinations. When is going to be vaccination available for people who are at home and who have severe mobility issues? So we have different possibilities here, but I cannot really answer you right now. So it's who's the service provider of home nursing service in Northeastern Estonia, because the health insurance fund has been organizing the vaccination for people at home through the home nursing service, and are communicating directly to the patient. So maybe you can send this question by email, and we will find an answer for you. So when we should be vaccinated if we have a patient who has type 1 diabetes, who will be turning 16. Type 1 diabetes is a risk factor, so he can get vaccinated quite quickly, because Pfizer vaccine is from 16 to 18, so this 1 month makes no difference. And so he's a part of the risk group, so I don't see any obstacles here. So this young person can get vaccinated. They will just have to talk to the family GP. Then why with AstraZeneca there has to be such a long waiting period between two doses? With adenovector virus vaccines, it's the longer the interval, the better immune response is. That it did not, we did not find it from the coronavirus, but it comes from the base comes from Ebola vaccine, and you could see that longer interval you had between the two doses, the better the immune response is. So therefore, the long waiting period so that the vaccine will be as efficient as possible. I would like to get Pfizer, but I'm not even waitlisted because I'm just being told that it's not available. So what should I do? Well, we have a lot of GP centers, 785 lists. So every list has its own counting system, but in Rapla, we have people on waiting listing that are first opportunity, for example, list. So we have a database. So if I know that my colleagues, their GPs, have been doing it list by list, so because right now it depends on the age group. So it's within weeks where people under 50, depending if they are 40 or 20, there might be a bit of a difference. We'll find out by tonight. So and they can also go to the vaccination office, vaccination center, and Pfizer vaccine is one of the vaccines being used. It's possibly then they're not part of the risk group and they're not waiting listed. So if all the European Union member states get the vaccines based on the same distribution plan, how come in Finland and Germany they have a higher percentage of vaccinated people? For Finland, I can answer 12 weeks is a waiting time between two doses, and you can see the result now. So if you see that how many people have had 2 doses, then you can see that Estonia is ahead. But if you see that how many people have had 1 dose, then Finland is ahead. So this is the 12-week difference which matters here. Germany has been vaccinating very eagerly of late, so I can't really comment on that. Germany went ahead of us, I think, only a week or 2 ago. Before that, we were ahead of them. So I think that not everybody has the same distribution plan because vaccines available based on the order. Estonia has taken everything available. We took 50% of Janssen and 150% of AstraZeneca. So we took everything as much as possible. And there are different quantities from additional contracts. So we have bought Pfizer and BioNTech, I think 630,000. With the main contract, then about extra 650,000, and some countries have bought more, some less, and therefore we have twice the difference with Latvia, not because Latvia would collect it, but physically they cannot offer the vaccines to the population. But now the levels are evening out. If you look at the EU average, that has improving. So because the distribution plan have been changed to help countries to catch up. And most of the EU countries are within the few percentages, 25 to 29. You can see how many have received at least one. And some countries, Malta, which ordered a lot more, and therefore they are ahead. And there's some who have ordered additional vaccines from outside the EU. For example, who ordered the Sputnik V or a Chinese vaccine, and therefore their percentage is higher. There's some countries who have ordered less, like Latvia and Bulgaria, and they have been at the end of the list from the start of this process, but they will catch up. And it really depends on the general interest of the population. There's a different hierarchy and ranking table there. Let us continue. How come we don't have one telephone number, but you have to call different centers? Not all the people are very good at digital services. This Vaccinated.ee has a map application, so you can look at the hospital and the phone number and register somewhere, which is somewhere close to them. But how come? What happens that if you cannot get to this website, you can call the helpline, and if you have the elderly. You can use the crisis hotline 1247, and of course you can ask your younger relatives to help. Because we've had call centers with dialing, for example, we had the vaccination call center, but there's a lot of technical and legal details I'm not going to get into. So it's not that easy that somebody calls and registers, because when it comes to protected health data and all the rest. And it's easier for people to contact the health center and then get information, vaccination times, and then they're going to be waitlisted. Anything else? So let us continue. So if I've been sick and I have 1 dose of vaccine, so does it mean that my vaccination is incomplete to have the right to demand the 2 doses? But if I've been sick and I don't know about it and I have 2 doses, is there risk involved?
I'll start with the first one. No, it's not unfinished. But if a person has been sick with COVID, they'll get 1 doses. So it'll mark the vaccination completed is the remark at the certificate from the Estonian aspect. That's it. That's done. We know there have been problems for some people. In some countries, they say that it says vaccination completed and you have received only 1 dose. But that is a matter for international agreements. One vaccination certificate was completed earlier than there was new knowledge on vaccinations. I can add here that if you have had COVID, in our program we'll enter vaccination completed. And if a country requests another certificate that this person has been ill with COVID, they have had a positive PCR test, then we can issue another additional certificate. Some countries, Spain for example, want to have that. Let's start from the end, where you have a decision that 1 dose of vaccines was given to COVID patients. It came from January, who showed that people who had been ill and had 2 doses had a lot more side effects than the ones that had only 1 dose of vaccines. So having had COVID and 1 dose is a very logical approach, and that gives a very strong antibody result. That's where the 1 dose theory comes from, well, theory and practice. But just as I said before, things can change. Thank you. Do they apply 10-day guarantee for those who come from abroad and were vaccinated more than 6 months ago? Israeli citizens were vaccinated in September. Why 6 months? We gave relief from isolation in January. But that was based on limited knowledge. Vaccines had been used for a very short time, and that was so the deadline was given for 6 months. Right now we know that it lasts longer, and the immunological committee debated it and made suggestions to the government that self-isolation should be extended. We need to find agreements between the medical professionals and lawyers. Medical professionals think in a different way. We don't know whether it's indefinite or there will be a certain deadline. We set our deadlines according to vaccinations in Estonia. The very first ones were done on the 27th of December. They got their 2nd dose in January, and their 6 month will be over at the end of June. Well, the same applies to Israel. If they were part of a study, then might have been vaccinated earlier, but the majority of the world was vaccinated the very same time. The all 6 months will come up in the end of June. So we need to find an agreement between governments as to how to apply the restraints. And the final question. If, as we know now, a person who has been vaccinated will spread the virus, so how can an employer demand vaccination to protect the customers? Nothing is 100%, but we've said time and again, vaccinations will reduce the viral load, symptomatic and asymptomatic illness, and a vaccinated person is safer for sensitive patients than an unvaccinated one. This is what we know today. And the final question. Can you choose in Digiluku as to what vaccine you want to be vaccinated with? Yes. It is displayed what is the vaccine used in a specific vaccination point, and people can choose whether to register there as well. For AstraZeneca, it's 50 plus recommendation. Younger people can choose between other vaccines depending on which slots are open. But the time has run out for us. We've been speaking here for nearly 2 hours. Thank you so much. Everyone on the stage here, all the best to you in your work, and thank you so much for everybody who spent the 2 hours with us, asked good questions, and hopefully got good answers as well. There are certain messages that I need to repeat here. New vaccination slots will be opening up, so if you have a chance, make use of it. Do not delay your vaccination. All COVID-19 vaccines are very efficient for avoiding serious infections and save lives, so we can keep up the functionality of our healthcare system, so we can relieve constraints and return to ordinary life. The virus has not disappeared. As we are going to face new waves of vaccination, it's important that maximum number of people are protected. It's especially important to have vaccinations for people that are older, frailer, or vulnerable. So let's give them the help they need in booking a slot and with transport. And although healthcare data shows that one vaccine gives a good protection, however, it is important to have 2 doses. Do not interrupt your vaccination schedule. There's a lot of conflicting information. Do check your information sources and use official verified sources. You have official data from Vaccinated.ee. The map application will show you the nearest slots. Frequently asked questions are answered on kris.ee, KRIIS.ee, and you can book your slot at digiregistratur.ee. This information hour can be reviewed at the YouTube channel of Social Ministry. We also have an information hour at ETV Plus in Russian. Thank you all. Enjoy the spring weather and see you again.